It is Breast Cancer Awareness Month, and believe it or not, breast cancer is the second leading cause of cancer deaths in women, and about 1 in 8 will be diagnosed with the disease in their lifetime. So it is very important for women to know what to look for when it comes to screening. And that's why tonight I'm so excited to be joined by Dr. Leif Ellisen, a breast medical oncologist from Mass General Brigham Cancer Institute. Doctor, thank you so much for taking time for us today.
My pleasure to be here. Thank you.
Now, I want to make sure we get right into the good stuff. So talk to me about when a woman should get her first mammogram. And I start with that because there have been conflicting ages over the years.
Right you are, Courtney. And over the years, the recommendations have changed. But fortunately, recently, the major medical organizations have unified and recommended that women start screening with mammograms at age 40. Now, as to how often to get those mammograms, there are differing recommendations. Some say every other year, some say every year, and that's a good opportunity for women to know their risk. Women who are above average risk most likely are going to benefit from getting a mammogram every year starting at 40, where women who are below average risk might just need it every other year.
Okay. And when you say above average risk and below average risk, can you break that down for our viewers? Because you might have some women watching going, okay, now how do I know which of those categories I belong to?
Absolutely. And it's another good point that you're raising, which is it's really important for women to know their risk. And some of the major risk factors we think about are family history, particularly close relatives, mother, sister who's had breast cancer. Remember that family history can be relevant on both sides, both your mother's side of the family and the father's side of the family. Other things relevant to breast cancer risk include things like prior results of biopsies of the breast that a woman might have had. Another one is reproductive history, and another one, alcohol intake, which increases breast cancer risk. So thinking about all those factors, discussing them with your doctor can really help in pinpointing your risk and how often to get screened.
Now, in addition to the importance of mammograms, it is so important for women to know how their bodies feel, what's normal for their bodies. Talk to us about walking women through that self-exam. How often do they need to do it? What should they be looking for?
Yeah, this is a really good question. And let's face it, it's not easy to do a breast self-exam. Breasts are lumpy. Lumps change with a woman's monthly cycle, and that is normal. But a few tips to think about and to be aware of are, one of the formulas I use is called the PDF, like the Adobe PDF.
Okay,
so
PDF, okay.
If we think about lumps that are painless, those can be more worrisome. You know, there's many things that cause pain in the breast, and it turns out that cancer is really not one of them. Most cancers are painless, particularly a painless hard lump. So that's the P. Another one is distorting, a lump that distorts the contour of the breast, causes a dimpling or a puckering. That's another warning sign. Most normal lumps do not distort the nice shape and smooth texture of the breast. And then for the F, something that's fixed, a lump that feels like it's stuck to the skin if it's a shallow lump, or stuck to the chest wall if it's a deep lump. So lumps that follow the PDF, painless, hard, fixed, distorting, are the ones that you might worry about more, and definitely see your healthcare provider if you see something like that or feel it.
And thank you for giving us a helpful acronym, because people may not remember everything, but they'll remember PDF.
PDF.
Okay. Now, doctor, talk to us about if there are any steps that can be taken to lower the risk for breast cancer, right? Because maybe a woman's watching and they're saying, okay, so I don't have it in my family. Is there anything I can do to prevent or lower my risk?
Yeah, it's a great question, and it's really an area where we're learning a lot. And one of the most interesting and important things we've learned in recent years is that breast cancer and the breast tissue itself is very sensitive to your metabolism. And what that means is that all the things that a woman does to be generally healthy actually can help decrease breast cancer risk. And we're talking about diet. We're talking about exercise. We're talking about avoiding obesity, getting treated if you have diabetes, as we talked about, avoiding alcohol and certainly avoiding smoking. These are all things which can help contribute to freedom from breast cancer, and in a woman who's experienced breast cancer can contribute to freedom from breast cancer recurrence.
Okay, so that's another reason to overall just to take care of yourself and to be in good health.
Double credit from the breast point of view, that's right.
Oh, this is good stuff. Okay, and then I want to make sure we ask you too, can you talk to us about some of the latest steps in treatment for breast cancer?
Well, there's been a lot of advances in recent years in making therapy more effective and also more personalized. We think about breast cancer, there's 3 major subtypes, and there have been significant advances for all 3 subtypes. The most common subtype is hormone receptor positive breast cancer. Just this year, we've had 2 new FDA approvals of drugs with different molecular subtypes of hormone receptor positive. The tumor can be tested depending on the molecular subtype, different drugs, new drugs, and better drugs. And we think of the other subtypes. Another one is HER2 positive breast cancer, which can be an aggressive subtype. And here, a whole new class of drugs that are called antibody drug conjugates, which deliver chemotherapy in a much more pinpointed and targeted way directly to the tumor. And those have shown remarkable advantages over standard chemotherapy for HER2 positive breast cancer. And then finally, one of the biggest challenges in breast cancer treatment has been triple negative breast cancer. And again, this new class of antibody drug conjugates have as much as doubled overall survival for women with breast cancer compared to the old standard therapy. So I would say that little by little, we're making really remarkable progress in survival of breast cancer and in the number of breast cancer cures. And I can't hesitate to mention that a lot of it is because of women who volunteer to enter the clinical trials where we can get the data and prove the effectiveness of these medications. So it's thanks to them that we have the data and know what to do and make these advances.
Women helping women in
That's
these
right.
trials. Well, you know what? We thank you so much, Dr. Ellisen, breast medical oncologist from Mass General Brigham Cancer Institute. Such helpful information for our viewers tonight. We hope that we get that conversation started. Women go get their mammograms. We're going to take a quick break. We'll be right back with more news.